Anti-ulcer drugs. Ulcers are localized erosions of the mucous membranes of the stomach or duodenum. They are usually referred as peptic ulcers, and occur when stomach acids damage the lining of the digestive tract. Common causes include the bacteria Helicobacter pylori infection and anti-inflammatory pain relievers. Anti-ulcer drugs are the class of drugs used to treat ulcers in the stomach and the upper part of the small intestine. These drugs aims to relieve symptoms, accelerate healing and to prevent the recurrence of ulcer. Anti-ulcer therapy aims to reduce aggressive forces by lowering hydrogen ion output, increasing protective forces by means of mucoprotectants and to eradicate Helicobacter pylori. Anti-ulcer drugs are classified into 5 main types. Histamine antagonists are specific for H2 receptors and do not inhibit H1 and H3 receptors. It reduces gastric acid secretion for long duration and pepsin for shorter period. They act by competitively inhibiting the H2 receptors on parietal cells of the stomach and reducing stomach acid secretion. Proton pump inhibitors are the most effective drugs for peptic ulcer. They are usually prodrugs and are weak bases. They act by reversibly inhibiting the hydrogen-potassium ATPase enzyme system of the gastric parietal cells, which is responsible for acid secretion into the stomach. Anticholinergics acts by selectively blocking the M1 muscarinic receptors and inhibits gastric secretion. It increases gastric emptying time and prolongs exposure of ulcer bed to gastric acid. They are rarely used because of their relatively poor efficacy and anticholinergic side effects. Prostaglandin analogues inhibit the gastric acid secretion, enhance local production of mucus or bicarbonate and help maintain mucosal blood circulation. Antacids are weak bases that neutralize gastric acid. They act by raising the pH of the stomach and decreasing the pepsin activity. It promotes mucosal defense by stimulation of prostaglandins and forms a protective layer over gastric mucosa. Ulcer protectives accelerate healing of ulcers without appreciable acid inhibition. Sucralfate, which is a prototype member, adheres to proteins on the surface of ulcers to form stable insoluble complex which acts as acid-resistant physical barrier. Ulcer healing drugs are effective in both gastric and duodenal ulcer. Carboxylone sodium is the prototype member. It accelerates short-term ulcer healing during ambulatory treatments. Anti-H. pyloric drugs are antimicrobials that have been found clinically effective against H. pylori. Usually, a combination regimen is preferred, using gastric acid inhibitors and antibiotics such as a proton pump inhibitor or H2 blocker along with amoxicillin and clarithromycin or metronidazole.